Endoscopic spine surgery is worth traveling for, and patients are increasingly making the trip for this ultra-minimally invasive treatment. In fact, I recently operated on a man who came from Alaska and a woman from New Hampshire on the same day. Quite the geographic spread. But when can travel patients return home? And when can local patients travel for work or pleasure? I recommend that patients stay in the area for one night after surgery. But I'm okay with them traveling either by car or by plane the following day. Patients should not drive themselves for 24 hours after surgery to allow the effects of anesthesia to completely wear off. And they shouldn't drive if taking prescription pain medications, although this is rarely an impediment. My main concern with travel in the immediate post-surgical period is not a spine-related issue, but instead blood clots. These can develop due to pooling of blood, particularly in the legs, during long trips. And the low air pressure on an airplane can also contribute. There are some strategies that can help reduce the risk of blood clots. Getting up and walking periodically helps keep the blood flowing. Pulling over and just walking around the car, or doing a lap up and down the airplane aisle every 30 minutes or so is advisable. And pumping your ankles up and down while sitting provides further protection. Fortunately, the risk of complications is particularly low after endoscopic spine surgery, partially because patients are up and moving around immediately after the procedure. So make the trip, or take a trip. Endoscopic spine surgery will get you where you want to be. Please like, comment, and subscribe for more content on spine health.